The opioids crisis and substance abuse crisis in general is the most important public health issue of our time. Last year, over 72,000 Americans died of overdoses, and that includes over 1,800 Tennesseans. So Tennessee is not immune from what's going on throughout the country, and in fact, on average, it's doing a little bit worse in terms of the numbers. There have been over 1,000 children born here with neonatal abstinence syndrome, which is a condition caused by having drugs in the body when the baby's born, and then when the drugs are gone, the baby withdraws, just like an adult would withdraw if they were taken off of their opioids immediately. So Tennessee again, has problems that the rest of the country has, but we're here because Tennessee is doing some great things. In neonatal abstinence syndrome, Vanderbilt Children's Hospital and the University Medical Center are really one of the world's leaders in pioneering treatments for these babies with neonatal abstinence syndrome. And they're also doing terrific research so that we will understand how to better treat them in the future and make sure that their lives are as full and rich as possible. The data collection systems in Tennessee are second to none. This is very important because we need to know what's happening and being able to track that. What kind of people are misusing drugs at a time? What kind of drugs are they getting on the streets? How is that affecting them? Are they overdosing? Are we getting reversal medications on time? So Tennessee is doing a really great job, and I think you're going to start seeing some trends in the positive direction here in Tennessee. We're actually already seeing that, both with neonatal abstinence syndrome and, very importantly, the appropriate prescribing of opioid drugs. We know that most people who wind up addicted to heroin or illegal drugs like fentanyl started with prescription opioids first. It might have been a prescription to them or just leftover drugs in the family closet or in the bathroom that people in the family start taking. And particularly with very strong opioid medications, once you're on it for a period of time, even as short as 7 to 10 days, you can become physically dependent and then become addicted to those drugs.